went back to Italy and got his MD from Padua in 1980. He practiced medicine in New York and realized the handwriting on the wall and went back to dental school in Italy. And I guess you got your dental degree in Udine? In Vienna. In Vienna, I'm sorry. Okay. He now practices in Italy. He's the manager of a group of natural dentists, and his subject today is the non-extraction orthodontic technique. I introduce Dr. Antonio Miclavez. Thanks for being patient with us.
Sure.
Everybody wanted to come on.
That's good.
Please, everybody, okay?
Yes.
This comes out like this.
Yeah.
Okay.
Actually, it's not the argument of the lecture, which means it is, but can you hear with this? No. Just with this. There's so many things to be said, and it's so embarrassing. I'm very embarrassed now, because I didn't know what to expect. When I came here after my medical degree and wanted to work in America, become an American citizen, I escaped after a couple of months from this hospital in New York because I thought it was terrible what they were doing. I was studying on American books, but what they were practically doing was terrible. Making all these analyses, protecting yourself against the chief of the department, and against all these things which you know about, made you forget completely about the patient. So I was in big crisis, and I went back, and I didn't know what to do. My father was a dentist. My great uncle had been a dentist, an orthodontist. His name was Schwartz. He used to make those plates, Schwartz appliances. Yes. Yeah. So all my life in my family, they were talking about these things. My father was very hard and tough, wanted me to become an orthodontist, nothing else. And so I was in crisis and said, what the hell? I do what Papa says, at least to show him I'm better than him. It was a fight we weren't both aware about until he died 3 years ago. And then I sat there and I said, what am I doing? Whew. So in this situation I found myself some months ago where Ada Rana got sick, and there is this big, this important. I don't find the word, but there's a big, not compromise, a big difference, which makes it's the same, but it's a difference. How do you say it? Huh? Paradox. It's a big paradox. His body is getting sick, and he has a hard time doing so fluently what he did before, but something is completely there. His humor, his spirit. So it makes you feel how it's useless many times what you do if you don't get in touch with this thing which Ed has. So when I heard about it, and Carol told me, come to us to the meeting, I said, listen, I'd love to come. First thing I said, I cannot come. I have so many things to do. It's impossible. But then I said, okay, I'll try to come and tell you some things perhaps you would like to try. And but you're here, so I want to tell you some things too. And basically, the communication would be about orthodontics, non-extractive orthodontics. So all what my father and my uncle Schwartz did not do, actually. They extracted many teeth. And but farther away from that, what can be behind all this? What you can gain, what you can get in touch with working with this. And I was very embarrassed. The beginning of this Congress was very scientific and very nice, beautiful slides. We have awful slides, very bad quality, and very scientific. And we're not. We're not scientific. I have a big reaction against being scientific. I remember a friend of mine said, medicine is not scientific. You take 100 guys and put them naked in the equator sun, and they should all react the same, but they don't. The first one gets sick right away. The second one gets hot in 10 minutes. Another one faints. After half an hour, not everybody's there. Some are dead or whatever, and somebody feels very good and says, hey, it's cold here. So we had the same cause that gave us completely different effects. And if we go in homeopathy, we have very similar things. So we're not scientific. And if somebody wants to prove us to be scientific, that's where we get to where medicine is right now. And then I found a beautiful lady, Dr. Kane, when I was over there, was in big crisis. And Carol was introducing me to very nice colleagues and say, here's this colleague, he does orthodontics. I said, oh God, I hate orthodontics. She said, oh, you're supposed to lecture about orthodontics. And so it was very embarrassing. I found a lady which has a beautiful spirit, I think, and she does things that we do in our office for orthodontics, actually. And the spirit was so beautiful, I just like her to talk a little bit in 5 minutes about what she does, because it's part of the spirit we have in our place. So, good. Another part we got in contact with was dealing about these numbers, which is very beautiful. We did a little bit of numerology too. Of course, we work with cavitation. We call it differently. We call it focus senation or focus equilibration, and with amalgam removal since years. And we had hard times with our president of the dentistry. They make counter every article we come out with in our newspaper. They come out with an anti-article, usually not signed, which says that amalgams are not bad at all. And we had friends who had fought with this, and one of them died. His name is Lavecchia. I don't know what happened to him, but suddenly he wasn't there anymore. He fell out of the 7th floor. So we had our little wars back there too, like you do have here. And my feeling is I don't want to convince anybody anymore. And I'm here to be close to Ed, and I'm happy you're here too. And I think I'll be able to communicate some things. Although my things are not scientific, my things are just very hardly things, and some of you might pick out some of them. But I'm going to have better pictures in the future, because this reaction against the scientific thing is still a reaction. It's not an action. So I should make this better. So can you please come a minute and just say, just 2 minutes, what you do, just to get in the spirit?
I found my work, these things happen, I'm sure all for a reason. Oh, is it not? Okay. I guess everything happens for a reason. And my gift was working with very young children and babies. And I had many wonderful mentors that I work with. Carlton Fredericks was a very close friend of mine. In fact, he saved my own child. And as the years went by, I began working with another researcher, defining simple tests that you could find the answer. Because thousands of dollars for the test, sometimes you come up with nothing. So I had the opportunity about 6 years ago to work with a baby that was born at 21 weeks of pregnancy. It's a 5-month-old fetus. So this baby was allowed to survive. A fetus is really not viable in the United States at this age. And the reason she was allowed to survive was because her mother was British, and she said, I want my baby. So they were stuck. So they called in me.
By the way, let me say a few words. This is Patricia Kane, who is probably the world's leading biochemist at this time in terms of the application to the human body. I think you may have skipped over that part.
Well, I do think that these children that we're finding, they are the teachers. We have to listen to our patients. They have the answers. We just have to listen. And this little baby, when I went to see her, she was literally a ferret. She was so tiny. And I knew I had to start with the very basics of chemistry. When a patient is ill, whether it's from amalgams or mercury poisoning, whatever, it doesn't matter. You have to go back down to the atomic level and work up. If you start too high in these biochemical chains, you don't know what way the patient's going to go. You cannot predict that, and many times the patient does not respond as you would like them to. So we go down to the very simplest level, and we just use blood chemistry, and we can tell that way and then build up from there. Now, obviously, we've heard over the years about lipid biochemistry and how important that is, and that's been a focus of my work for a very long time with stroke patients and traumatic brain injury. But this little girl is now 6 years old. This is when she was actually 2. She's completely normal in every way, that tiny baby that you saw. And it was just using electrolyte therapy, lipid therapies, and so forth.
The way you work with them, when you feed
Right.
them.
Now, what we did with this little infant right in the hospital, I don't have any problem in NICUs or ICUs, Once the medical profession has given up on the patient, they don't have any problem with you coming in. But everything I do, I usually have a stack of medical papers to explain what I'm doing, and I use their terminology. I certainly never say vitamin C because somebody's eyes might roll back, but I do use words that are very comfortable, electrolytes or technical words that are safe. And I find that many of these physicians, they are truly researchers. Once you spark their interest and you explain what they're doing, they're not negative at all. But there's a fear factor. When you're looking them in the eye, they're so afraid you're going to find out what they don't know. And when you have a hopeless case, you can actually do this because they don't know what to do. They're frustrated, they're embarrassed, and they've written the child off. So I find that you have your greatest power in hopeless cases. So with this little infant, right in the hospital, we would put her in a bath of electrolyte and do movement therapy right in electrolyte water, and it works topically as well as internally. And another little baby, a little girl, suffered over 30 minutes oxygen deprivation, and she responded very beautifully to natural therapies. She luckily did not have vaccines at the time, and she did have quite a serious brain injury. Little Mary, when she was 4, had a very serious condition. She simply had the flu, but a nurse accidentally put her enteral feed into her lungs. And she became quite ill, and this was San Diego Children's Hospital. And again, they asked me, they just wanted to take her off the respirators. They were giving her the wrong electrolytes. Now this little girl was very rigid when we began with her. In this rigidity, you'll see in patients the same, this lack of control when the patient has a stroke or MS. There's gross lipid involvement. So if you think in terms of, how am I going to solve this problem? You've got to go back to the electrolytes and balance those first. With this little girl, as she became ill, they gave her the wrong electrolytes, and she literally, her cells swelled up, locked down, and nothing would go in and out of the cell. So the first thing you're going to look at with many of these patients is, how do I detoxify them? It's true, but the body will not release toxicity until you balance the electrolytes and regulate the membrane traffic. So that's point one.
The part about the feeling, only that.
Right, and this little girl, when we went back into using patterning to stimulate her brain, we found that we had to literally use craniosacral therapy at the same time we used patterning because her body was so rigid. So first we used oral electrolytes and lipid therapies specific for her need, and then we began combining therapies together, and she responded quite beautifully. And then you can add on color therapy or homeopathy or whatever as an adjunct to all of those. And so it's really sometimes a matter of combining therapies, but you must get the raw materials in and determine what your patient needs in regard to combination. So
Thank you.
let you go.
Thank you. Okay, can I have the slides, please? This one is up there. This was a period in Big Island with Jane Ocean. Can you please put this up further here?
Remember June this year, we have the dolphin swims.
It was with a girl whose name was Jane Ocean. I don't know if you know her books. And we stayed there 1 week. In the evening we would just sit together and meditate together. At night in the morning we would get up at 6 o'clock. Dolphins would swim out and stay with these persons. They would play with us water polo with little leaves. As you see there, they would pick them up on the bottom and play with us. We would try to snatch them, but they would come very fast and get them away. And once we managed to get one away, they were very surprised looking at us. How did they get our leaf away? We weren't supposed to. Very beautiful. And they were making love together. It was a love time. Jane Ocean said she's never seen that before. It was a beautiful environment. Sometimes they would get around us and all do like this. We would come out and cry. Half an hour, didn't know what was going on. Remember old things. And then we went to Jane and said, I went to Jane and said, strange, I think about my youth and it looks so rosy. But I thought before it was not rosy, it was bad, I had a bad stepmother and so on. She said, that's what dolphins do. They paint your past pink. Okay, so I hope you can do this experience together, which is really beautiful. And these are designs which her former boyfriend made. He thinks dolphins and UFOs are somehow together. When Atlantis exploded, he said, some decided to go away. These are the UFOs now, and some went in the water, and they're the dolphins. So it's a way to get in contact with these UFOs, and this is the story. Okay, how do you get? Yes. Okay. Good. So, back to the sad part. This is... Paolo, puoi tirare giù questo per piacere? Okay. I don't know, how many of you do orthodontics? How many of you don't do orthodontics? Okay. So this is orthodontics, and this is what? This is... Yeah. This is what was we were trained to, and since I told you this, the family story, what I try to do is to learn the best. So I went around the world and I went to people you probably know, Ricketts and Jarabek, and I ended with one and Toll, and I ended with people which I thought were just perfect, very scientific. One was Danish, his name is Bøtter Melsen, the other guy was Charles Burston. They were calculating anything they were doing, which is very beautiful. So I thought this is the best thing. When I got there, I thought it doesn't matter what wire you use, what inclination or so, this is okay, but these calculations are very good. So I loved it very much, and I thought I'd come very, very far. And with all these elastics, always more complicated. And the more complicated the calculations got, the happier I was. But all in a sudden, I knew them very well, and I got very depressed, and I said, what's now? What's next? What did I reach? I know theoretically everything, but you know. So, and one day I was, these calculations, and this is Fontanelle, perhaps you know. They use, segmental arc technique and so on and so on. Very beautiful, very complicated. And this is another guy, his name is Fontanelle. We used to do this kind of bridges to move single teeth, calculating how it moves. And it was very good, but this doesn't go on. And can you please go on here? How do I get on here? Giorgio, mi puoi andare avanti qua? Okay, and then all in a sudden, when I came down from this place in Denmark, where I had been for some months, and we were going perhaps to review a book together, I was very excited. I came down to a guy, his name was Christoph Hermann, and he was in Germany, and I went in his orthodontic office, and I knew everything, although the people that were sitting there looked beautiful, they looked equilibrated, they looked happy, and they were orthodontic patients. And suddenly I realized the orthodontic patients I've seen before are all cripples. Not all, but tend to be cripples, and those tended to be open. And then I went in the office, and I watched what he was doing, and he was using very simple plastic devices, like this you'll see later. Nothing pushing, nothing pulling, wires not touching the teeth, midlines getting okay, deep bites getting okay, class 2, class 3 getting okay. My mouth stayed open. I said, I don't understand. Where's the calculation? How do you do that? It's not scientific. It's not scientific what you're doing. I don't like it. So it's like when you're steering the wheel, you cannot turn right because you don't know the wheel, how much it's the friction of the wheel is, so you cannot turn, he told me. And it's working, and it's okay, and it's fine. And patients were coming, very complicated patients. He said, yes, it's no problem, we can do it, yes, yes. What do you mean, yes? It's very complicated. I said, no, don't worry, don't worry. And then I started worrying, and then in my office I had on Mondays we had Tweed, on Tuesday we had Jarabek, on Thursday we had Ricketts. On Friday, secretly we started doing these things. It's very complicated to get them all together. And this is an appliance which perhaps you know, and I just wanted to show you it might have some problems. So I started opening my eyes, where are the problems? For example, the tongue doesn't go here, and if you see the reflexes here, puoi mettere a fuoco per piacere, Giorgio. You can see it's the epiphysis and the pituitary gland and the thyroid. So when I block the palate, the tongue to touch these points, perhaps I stop the stimulation of these points. So this is going to be one of the problems.
Oh, don't move it yet.
What?
I'm writing down the reflex.
You're writing down those?
Yeah. Just give me a moment.
Okay. So even if the indentures, we try to do those holes right now to have the palate be stimulated. Most of you know craniosacral therapy, right?
Thank you.
So it's nothing new. It's also hard. I don't know what you know, what you don't know. You know, who doesn't know craniosacral? You all know craniosacral therapy. So what the tongue actually does, one of the things it does, rhythmically it goes up to the sutura palatina and activates it and stimulates the head. Another thing, knowing craniosacral therapy, how can you use all band therapy? How can you use a cross-palatal bar? You're stopping the head to move. 8 times in a minute the head breathes and moves, so I cannot stop that. So how can I stop, or how can I resolve monolateral crossbites? How can I solve midline problems without operation or without asymmetric tooth extractions or with those elastics you've seen before, which are very harmful on the TMJ. And so to make a long story short, we ended actually with this machinery. This is a bionator. You know what a bionator is? Yeah. Oh, you all know a bionator. See, I'm in the wrong place. Everything already. It's very embarrassing. If I come again, I have to prepare completely different with lectures. A bionator works in a very strange way. It works in a very strange way. We used to think in mathematics and physics, but if I happen to blow over this paper, what does it do? It goes up. And I have saliva in my mouth, so it can create little places. When I swallow, the saliva accelerates in those little places, and the tooth gets pulled there. So the tooth actually can be pulled vestibularly, distally, mesially, in any place without anything touching the tooth. This is one thing difficult to understand. Another thing difficult to understand is these wires don't touch the teeth. So if they don't touch the teeth, how can the teeth move? Well, the point is that the teeth are where they are because the muscles sent them there. You know old Daniel Garliner, I guess? You know him, yes? Yeah? And who gives information to the muscles? The brain. The brain gives information to the muscles. Now, something might happen, in one sense very beautiful, like it happened to Ed, which means you get a subtle accident where you forget many things and you get in contact with other realities. You can move your arm, because if I put an electric stimuli here, you can move it. You can think to move it, so the cortex works. But if you want to move it, you cannot. So what doesn't work is something in between. Now, you can reprogram this, and I'll show you later one slide on about how to do this. The important thing is about this bionator down here. It doesn't stick in the mouth, it doesn't stick in the upper jaw, it doesn't stick in the lower, so it leaves the craniomandibular respiration intact. And the other devices we ended with are these crozats, and if you can see, they're very thin. They're very thin, much thinner as they used to be from the books. The point is that they used to make them in gold, big thicknesses of gold, and now we're using steel, and if we use the same thicknesses, we're going to have problems. So we got them smaller and smaller. When we were working with, in the Charles Burston department, we were working with 5 grams. Now to shift the teeth, it's enough if you put 5 grams. So we don't use big forces, it's enough to use these very little things. Well, another thing which you know is the head moves, the head breathes, and we have symmetries in the whole face and in the whole body. So it's useless to say the problem is in the upper, the problem is in the lower jaw, the problem is in the whole body. So until we don't look at the whole body, it's useless for us to straighten just the teeth. Okay, and here are a series of mistakes that we are confronted with in orthodontics. But orthodontics is just a way, it's just an excuse we have to treat a series of problems. Now, the main mistake is the decision on the midline. If the right midline is right or the upper midline is right. It's like me looking at you and saying, one of my eyes is different, guess which? So the ones who laughed realized what this means. Now, the lower midline is to the right and the upper midline is to the left. It doesn't mean that one is right. They're both crooked. Why? Because if you look at the tree, like here, you look at those beautiful trees on the 17 miles walk, you can see that the tree is this way, but the roots are on the other way because the wind had been there, the wind had blown. It's not that the roots are right or the upper part is right. It's an equilibrium of forces that worked in this way. So when we ever decide, again, to extract asymmetrically in advantage of the upper or the lower, then we should know that the person is crooked and it has been developing this malocclusion because all his muscles have been working wrongly. Now, how can we equilibrate these muscles? This is another thing. Another thing is the x-rays we take are bidimensional, while my patients are tridimensional. I don't know if your patients have 2 dimensions or 3. And so I'm sorry I don't have this picture, which actually Arthur Martin Schwarz made, but you'll see some very badly done with mirrors behind. I guess you know them. You have a mirror here, mirror here, mirror here. So at the same time, you can see 3-dimensionally the patient. And you can take marks and you can take measures and you see how different the right side from the left side is. I don't say that this has to be class 2 and this class 3, but there might be such differences which tell you this is just too high from the normality because this one is too low from the normality. So what you come out is like we say, what statistics are, your head is in the refrigerator and your back is in the oven and you are the right temperature. So this might be the same thing, yeah, the same thing with X-rays. Actually, we used to sell a machine for X-rays because I like to get in marketing and so, because I'm not good in it, I guess, so I like it. I like the challenge. But we used to tell the people who wanted it, we don't believe in it. And my father used to say the same thing. Don't do it. It's enough to look at the person to understand how it is. Now, I believe X-rays are an excuse, and we need it legally. It's very important. We have to protect ourselves legally. But these analyses are an excuse to decide some things. We give the decision to the computer or to the calculation. And this is good legally again, and it might make us breathe more easily, but we have to know that we gave the decision to somebody else. Okay, another thing, if we played, we got 10 colleagues together and we gave them the same x-rays and they took the marks, and then we made a nice bell curve and we see how many mistakes have been done. The mistakes were so big that we decided from there on it's useless to make an analysis. So it was the next thing. I don't know if you're better, but these guys, we all thought we were very good. So another thing, if you look at various analyses, let's say the inclination of the lower incisor to the mandibular plane. Now, what does Tweed say? How many degrees? 90, good. How many does Jarabek say? Okay. Now we go anywhere from, I think, 84 to 110, which is Björk, and it's a big range. So if one guy says we have to extract, if you don't, you're wrong, and another guy say you have not to extract, if you do, you're wrong, then it might be that these guys have to talk better together, and for me to start looking and feeling what I think is right. So this was my ending, my conclusion. This is part of a conference I had in Baden-Baden, which is a very nice place where many doctors meet. In Germany, there are about 1,000 natural dentists. In Italy, we're about 100. How many are you in America?
5.
Your humor is beautiful. Okay, I forgot what I was saying. What? Baden-Baden, yeah. In Baden-Baden, one guy stood up and was very mad and said, you don't know what you're talking about, because here I'm talking about rickets. And because rickets has so many, well, what I say here is that the equilibrium of the teeth is a muscular equilibrium. It's not a statistic equilibrium, so the muscles pull the teeth in that way. You know, if you have a cancer or an accident, you cut a piece of your lip away, your teeth right away go like this. It takes a couple of weeks. So it's crazy not to think that it's like this. Another thing is that rickets VTO, visual focused analysis, you know, it tells you how you're going to be in 2 years, only works when the function, which is the way you talk, the way you swallow, don't change, and the way you stand don't change. But since in our practice, orthodontic practice and TMJ practice and back pain practice, which is one, we try to regulate these things, the VTO doesn't work for us. So what's the use of the VTO? This guy got very mad and said, rickets only tells part of the parameters we have to take in account. And I said, well, but if it's just part, it's not enough. Then, okay. So, again, these are just some of the analyses which show you, which you didn't see because it's too small. This thing is very small. And this is the story I made up. I don't know if you got the handouts I made or not. No, you didn't get them. Carol, they are there, so you might take them about the orthodontic story. So I made up a story, which is this guy. I don't know what the guy with a how would you call him here in America? No, a name, just a name. Augsburger. Okay. By the way, the Augsburgers are my patients, and they were like this, and some of them really changed. And I tell you the story about the Augsburgers on the reason why they're like this.
It's a royal family in Austria, and this kind of chin is named after them because they all had it from the inbreeding.
The Augsburger lip, they call also. This is the Augsburger lip. Actually, what is, have you ever watched the children? They come in your office, they are 4 years old, and they start doing this. I don't know if you've seen this. It's an attitude which gets you to class 3. No, that's right. I remember a little boy used to do this. And after 1 year, he had a big bony bump here. So what we do, we get these little patients, we talk with the parents, we let the little guys play, and we look at them like that and see what they do. So actually the Augsburgers, the reason why they're like this is that they're very hard. They were leaders. They're not anymore. They're nice persons, but very hard. And I had them in treatment. I didn't extract any teeth. I didn't send them to operation. And some of them turned well, somebody so-so. Actually, one of the oldest got in treatment by a colleague in Lausanne, a very well-known guy, and he relapsed terribly. He extracted 4 teeth, and I've seen him 15 years later, he relapsed terribly. So you know that even extracting teeth, you have terrible relapses. Anyways, I was trying, and these guys are very hard. The family is very hard. They have to be rulers. They cannot show feelings. And I was trying to fight for the last guy. His name is Antonio, like me. And the mother said, oh, come on, pull the teeth. And he's like this. I said, no, let me, please, let me. And so we tried, and his father came one day, and he said, listen, this guy, perhaps he has to be, you plan too much from him. He's too hard. Perhaps he, have you ever watched? He does like this sometimes, you know? And he said, yes, I understand. From now on, you will wear better your appliance, right? So he understood. I mean, he did not understand because my communication was try to open your heart to him, try to feel how he is, try to feel why he wants to show up more than he is. All somatic problems and also cancer are a way of the soul to show through your body what's going on. If you have to be aggressive, you're going to be like this. If you're used and your tactic is used to be a victim, then you're going more to be like this. A little bit like I am, class 2. So this is the psychological part of it, and we'll make this story. So this is a guy who has a big mandibular, and this is a girl who is class 2, and they get together and they get married. Okay? And okay, they're together. Here they get married, and what happened? This is a beautiful tantric love act. I mean, it's beautiful, and the world and the universe, and it's all in one, and so on. There's a cosmic orgasm, and it's wonderful. And this happened in a backyard, and it was very bad, and I don't know what happened, but this is supposed to be a love act which is not so beautiful. And this is the start of the story. I don't know what the names of these guys are. How do we call them in America? The man is John? I don't know. Joe, and the girl is? Janie. Joe and Jeannie. Okay, and here's Jeannie. And here's Jeannie. And she's very loving. And she likes it. There's a beautiful lady over there. And I feel like the way she is, that one, yes, you, with the beautiful stomach. The children feel everything. The children feel everything. And it's possible to live again as a grown-up, these feelings. And what we call character is simply an imprint of that time. Okay, I have a patient, and she, at the beginning, she was working very hard, and she lost her child at the 7th month. And then she succeeded in doing what she wanted. Back at home, they make furniture, and she had very much success. But she was working all the time. She was holding the accounts. And the child that was born was a girl that's always studying and working and studying and working. And then she got the last girl, and she was happy, things were working well, she could have accountants, and she was creative, she was making her own house, and she was getting all the color she wanted, and the girl was a girl that was born happy. And there was such a big difference that we talked about it. Another story I want to tell, just also because of you, is that my girlfriend told me there's a girl, she always laughs, she's a friend of mine. And one evening my girl told me, said, "Oh, I'm so sorry, I couldn't come. I'm so sorry." "Are you the one who's laughing?" I said, "Yes, yes, that's me." And then they told me the story. She's almost always laughing. Her mother was pregnant, and she was at the 9th month. She was with a friend of her, and they were trying to bake a cake, and the oven didn't work. And so they went to their girlfriend's place, and they tried to put in the oven the thing, and the oven was broken too, and she started laughing. She started laughing, and they had to carry her to the hospital. And then the child came laughing to the world, not crying. And this is all character is, probably. And the way is to get in touch with these feelings. A beautiful way is to get in touch with these feelings. And we as dentists, we know what an intimate area we touch. Very particular intimate area. So, anyways, here this lady has a loving pregnancy. Here this lady, well, not so much. He's worried, doesn't have a father or whatever. And then many things can happen. This lady can have accidents. You can see a spider, a snake, a car accident, a whiplash or whatever. Or she can have a beautiful pregnancy. And then when the child comes to the world, of course, it can be in a natural way. It can be not natural way. And we know all these things. The experience of the tunnel, it's very important. Life, death, this is very important to do it again. And here's this beautiful milk container, which is the breath. It should be used not like this. And here many of the problems start. Deviate swallowing, and the guy has to, or girl has to stop the milk flood like this when he swallows. Well, here he has to pull all the time. And also many other things which are very important I don't want to talk about, but you know how much important milk is. And then what happened, and this is very important for add to here, there's a woman whose name is Beatriz Padovan, and she is in Brazil, and she works with a technique which can be very, very useful for adult runners. What? Yeah. And I was in Baden-Baden. When I was there in Baden-Baden, she was talking about this, and she wasn't really understood by the orthodontists. And they say, "Who cares about this thing? We're talking about the mouth." And Daniel Garliner talks about the mouth, and they are talking about the whole body. So what does it have to do with all the body? The mouth. We're not doctors, we're dentists. So anyways, I liked it, I loved it, and I went there in Brazil. I stayed there 2 months. I did on myself the treatment, and I got a therapist to Italy, where she was. Now she's married, she has a child, and that's how the stories go. But if your child starts not walking enough, getting on one of these things, not crawling on the floor, he does not develop enough the autonomic system. And it's not just the mouth, it's the whole body. Because if I walk like this, I don't realize it perhaps. I'm good in football and baseball, but I'm crooked, and I stay crooked. And if you come to the dentist and say, "Look at the teeth," the dentist should look also the back, which is crooked. He might look also at the neuromuscular function, which is not coordinated. You can see this boy, how he works. We call it walk like a cat. And when he's here, he just looks to the right and his thumb is out. And here he looks to the left, his thumb is out. And the knees follow like this. Now, if you can do this, then you did what you should have done. And we say the ontogenesis follows the phylogenesis, which is the development of the species is the one you follow in your belly. First you move like this, like a snake, then like a fish, etc., until an ape, you stand up, and then you're a man. No, if you didn't follow these things, there's a possibility to do them again. Okay, now, there were guys like Doman and Delacato who did this in a quite neurotic way. I don't know, are you aware of these people? You know them? Yeah. Huh? No. Anyways, they did this. The idea was you just do these things. You do them over and over and every day and every day. Okay. So this method is not very well liked because they think about this. This lady went to a guy in New York. His name was Temple Fay. I guess you know about him. And he told her some other things, which is the mouth. The mouth has a huge nerve ending on the brain. So if we don't work with the mouth, we're not going to coordinate the brain enough. And then these people are anthroposophists, and they work with their heart. Working with the heart means getting situations like telling stories and making rhythm, which is very important, where you activate a part of your brain, which is the limbic system. Now, McLean describes the brain in a very simple way. I never understood the brain when I studied medicine, but he just divides it into three. One is the cortex, one is the limbic system, and one is the reptile system. So I guess you're aware of that, and I think it's very useful to divide the brain like this, because you know how to work on it. I don't care to divide it in 100 pieces if I don't know to work on it. But if this is the brain, there's a cortex, which is, I know what I'm doing this. There's a limbic part, which says, I have feelings, I feel somehow with you. And these feelings go to endocrine glands, which make my hands cold right now, which make my stomach have a problem, which makes my left breast to have a cancer because of a problem with my daughter, which I'm not aware of. And if I ask you, are you aware of the problem with your daughter? No problem. And your mother, oh yes, my mom, and she starts crying. When she starts crying, a door opens, and if this door opens, the somatization goes away. It's very possible to get it away. That's why I'm very much for feeling and getting in touch with feelings. That's what you would do with your patients when you start rocking with your patients, feel with the patients, cry with the patients, get in harmony with the patients. Okay, and down here is the reptile system. The reptile system makes us move. If I move like this, I'm doing with my hands this. Now, if I move like this is not coordinated. Now, Domandola Kato worked here. Here you can work consciously. I put my hand here, and here's the feeling. Oh, I feel in a particular way. If I add these three things, a guy named Gurujev did it. I don't know if you know Gurujev, or Uspensky, you do. He did these beautiful works, and they did it over there in Brazil too. They made a unity of these three parts, and it's a magic unity. And to make it very simple, and I should do it, you walk on the floor, you crawl, and whatever, all these things with nice rhythm, nice music, nice poems. So you move the heart, and for example, you count 1, 3, 5, 7, 9, or back, and so. And so you activate this part too. If you do this, magic happens. You can reprogram your brain from the bottom. Actually, you reprogram it in a very quick way. I remember we had a patient who had a problem like Ed, and we couldn't get his leg down. He was walking like this, and he couldn't get his leg down. Every time he would go like this. And you could push it down as hard as you wanted, and his tongue went this way. It took just a couple of sessions. Suddenly the leg went down. You could really, wouldn't go down. And the tongue wasn't hitting there anymore. So this coordination had happened. And what I like is to coordinate the whole body, not just the tongue, forgetting about another part. Okay, so this is another thing we do. I understand we cannot do with every patient, because if they come to us and say, this tooth is crooked, do something, I cannot tell him this whole story. But you can decide whether to do it or not. And we are all brain damaged. We're all brain damaged. We're all badly coordinated. We're all unhappy and depressed and demotivated. And the funny thing is, while you do this, you get more happy. I remember a movie where penguins were sliding on their back down the ice and having so much fun. And life is, what's the reason and meaning of life? I don't know. But if you find happiness, simply moving or breathing or so, then it comes out from somewhere which you don't know. Not from your Cadillac or from your beautiful house, but from somewhere you don't know. And that's the part that really sticks to you. Good. So we did do the things of Galina, which is deviate swallowing treatment, but we forgot really about it, and it's not enough. It's not sufficient, and I think it's also a little bit misleading. Good. So then again, this love thing, what the hereditary of the Augsburger lip is and Menton is the tension. The aggressiveness, the demanding part. We have been leaders for 300 years. You must be a leader too. You're an Augsburger. Okay, yes. So that makes hereditary this mandibular. Or you can give just love, and then what happens probably is the kid equilibrated like this, or a kid with big problems like this kid up here, which has lots of problems which he doesn't know about. He comes to the orthodontist, and the first thing we should treat are the parents. Yes, because the parents want something, and I'm not a very easy person to be with. Part of my work, the most beautiful part is psychotherapy. It's cathartic psychotherapy, which is if you come to me it might take me 5 minutes to start crying. I start vibrating with you, and I start feeling where your pain is. And I might say, oh, how about this, and how about that? And if it's right, you start crying. So it's very hard to tell this. When the parents come to me and say, help my child, it means so many things. It means let him look better, how I haven't been, or I hate my husband, and he hates the parents, so he doesn't wear the device to show that the parents that it doesn't work what they did. And this is another very important part, the psychological attitude of the children. I ask them, do you want the treatment or do your parents want the treatment? If your parents want the treatment, I won't do it. And so there's one test, it's called Lucia test. You all know the Lucia test. No? What?
Color test.
The color test, yes. The Lucia test simply says that if I'm dressed in green and yellow, it has a meaning. If you're dressed in red, it is another one. If a guy is dressed in black, another one, and so on. It means that if you like a color, then, you know, red means aggressiveness and energy and, you know, fight, and just blue, remember the blue, look at the sky, more relaxed, and so. There are all these prototypes which work. Yellow is communication. If you find a yellow car on the road, you can go and ask where to go. He's going to talk to you, be very happy. If you find a black car, he won't even talk to you. Oh, sorry, somebody has a black car? Okay, so we did Lucia test to the children, sometimes to the parents. And what we saw, it was very interesting. I'm sorry I don't have again these things here. But we saw that what I told you before is true. So if you're aggressive, if you have to react somehow and create your own sphere, you're going to be like this. And if you tend to, and your way of defense is escaping, going away, say, okay, beat me some more, it's okay, I accept it, then you're going to be more class 2. And we've seen that if we equilibrate the children in these ways, not with headgears, not with extractions, not with surgery, if we try to equilibrate the people with this strange device, which we don't know too much how it works, then the Lucia at the end will be more equilibrated, which means these people are going to be more leaders because it's in their blood to be more leaders, but are not going to be aggressive. You see the difference? Like I have to be a leader, but I cannot, so I am very aggressive. But if I'm really a leader and I feel myself as an emperor, then I'm going to be that way. I don't know if this came through, but it just, for example, if a child chooses brown and black and gray, we say, okay, it's very nice to have you here, but why are you here? You know, black means I don't want to communicate too much. Brown is conservative, it's okay, you know, and gray means not change. So what do you want? And usually comes out the problems that are there. They want me to do it. But since we're working mostly with removable appliances, we must win the confidence of the child. And because if we say, yes, you will wear it, then he won't, and he will wear it in his pocket, and our patients are private patients, and if it doesn't work, then it's our fault. And it's a way of the child to react and to get revenge of the parents, to show them that they choose the wrong doctor, and then we have the problems. So we prefer not to work with the child right away, but to get confiance and so on. Okay. Okay, so if this is the theory, then what can we do? What can we do in praxis? If this is it, if this child really doesn't see well because his eye is up and this is farther down, you know, the eyes can usually see better. What doesn't he want to see, by the way? If the occlusion is crooked, if the head is a banana head, how we call it, if this ear is out like this, his shoulders up, and his knee always has a problem on the midline. Of course, the meridians pass through there, and we have to check the meridian, but here we're just talking about static. All that's been talked about is so beautiful in such a high level. About Nico and amalgams, but this is just static. If the static is crooked because the muscles have pulled in a crooked way, because the brain has been working, and this is a little complicated to explain right now, I just can explain it with this, but it is every reason in every tension of every muscle, and it's possible to release it, and many of you work, I guess, with these things. So many things come from California, that's also the reason why I'm embarrassed, because you know better than me. But I can work on muscles, and suddenly you go, oh yes, yeah, and it comes out, and the muscle gets released, you know. So these tensions can be released like that. And if a parent comes and says, oh, the back is crooked too, is that the cause of the crooked teeth? Or is the teeth crooked, the cause of the crooked back? Then it takes 1 hour to explain the whole story in our eyes how it is. That everything is crooked together, and the ways to equilibrate the whole thing. Good. Now, excuse me, it's in Italian. And so, okay, what can we do on on orthodontic patients, adults or children. You know, orthodontics on children work usually very well. Children equilibrate, on adults not so much. We have about 20%, we have about 500 patients in treatment, so the office is quite big. We are a group of doctors working together. Only in a whole, the team is about 20 people. And we have many patients that come with backache, with TMJ problems, and we tend to treat them exactly the same. Okay, we used to do bites. My teacher was Slavicek. You talked about Slavicek. Somebody knows Slavicek? Rudolf? No, don't, yes, you know. Anyways, the guy who made the SAM articulator, he's very concerned about bite splints, centrifugal bite splints, compressions bite splints, and all these things. We've been doing that. I know you do kinesiology. So with a bite splint, you might check the equilibrated way where you can do your splint. The end after the splint is that you take this, either you become, okay, if you have an acute problem, you get a splint. You solve the problem because you also do other things, and this helps too. When you get, either you become splint dependent, or when you take it away, you have to grind the teeth and do crown and bridge work. If we make it to do orthodontics, which we make it to make an orthodontic splint, we'll have done a big thing. But the problem is, I don't always go in the equilibrated place. Let's say the heart is stiff here and it's weak there. It's not said that I go in the hard place because I want to have the teeth straight. So craniosacral therapy helped us very much, actually. And another device we built, it's just a scale. You stand up, I don't know if you know it. It existed already, but we developed this for this purpose. Every little movement I do, like I do this movement. When I close my eyes, I tend to shift on this side, for example. You want to stand up a minute? Just a minute? Okay, good. Just breathe deeply. It's a very long day. Yes, and try to stand with your eyes open. Just try to stand and watch the way you stand. Watch the micro movements you do. If you really are sneaky, watch the neighbor, what he does. Okay, now, if I tell you close your eyes, you can't watch your neighbor anymore, but you can watch yourself. Close your eyes and watch what's changing. Did you notice if something changed? Okay, there was a change. It means you're compensating with your eyes. Now, open your eyes, bite your teeth together, and see what changes. Okay, did something change? Okay. Now, open your mouth completely, open your eyes completely, and see what changes. Okay, now stay like this and look with your eye completely up to the right. Head straight, eyes to the right, and look what changes. Okay, okay, thank you. These changes, these little changes can be shown on a computer. And these are very interesting because they have frequencies. And we can work on different levels of the head. We can work on the on the back, we can work on the feet, we can work with a bite. And here again, we end it using these bites, because these bites, I'll show you now, are very important because they respect a series of things which normal bites don't respect. So again, after the bite, usually you have to become either dependent or you get treated because your acute phase is over, so you can bite again in your wrong old position. Or if you want to use an orthodontic bite, it might bang against your knowledge, you all know Jenkelson, of course, what he does. That also gives us problems because I want to go in a strained position. So in my office we have a couple of craniosacral therapists. With them together we developed this platform. And they told me many times it's better to go in a strained position, which is if you're crooked like this, you might have to go a little bit more crooked. And it's against this, and it's against the Maya monitor of Jenkelson. So we tried it with the Jenkelson method, we tried it with this, but then we realized we want to move teeth. And while we move teeth, and while we swallow normally, some things might happen. The magic is simply to have a piece of plastic where you bite on, and this piece of plastic has a little metal on the palate where you're stimulated to go with your tongue. Now, can you please come up?
Definitely.
Thank you. Okay. Now, if I tickle, can you just look there? Mm-hmm. Yeah. If I tickle here, mm-hmm, there's a reaction. The guy tries to swallow right away. If I tickle here. If I tickle here, if you take cold water and put it on your face, you're going to have a reaction. Mm-hmm. And there are about 200 different, thank you, that's all. There are 200 different reactions that are triggered just automatically. So we think we know what we do, but they're reactions. I simply just walk. What happens? The reactions. So what this device should do, or any other device should do, you should trigger just touching it, the tongue to go on the palate where it should go, and this should trigger the lips to stay closed, like this. It's a sucking reflex. So if I have a device that's completely removable, so it doesn't disturb the craniosacral rhythm, we'll see the the construction works, how to take it, and that stimulates the muscles to work in an equilibrated way and allows me to talk not too bad. This is a device which I can keep in my mouth the whole day long. And I should do it. What happens? The condyle gets remoduled. It changes. It gets a new position. Classes 2 get into class 1. Okay, so the magic actually, I think, is getting a piece of plastic where your muscles are stimulated to work well. Because if the muscles do not work well, old Uncle Schwartz's plate used to close the palate. It's a big mistake. You don't go with the tongue up there anymore, and you start a deviate swallow and a completely deviate moving mechanism. So what do? We can use magnets for the eyes. We use color puncture for and this run neurologic reorganization after Dr. Padovan to recoordinate the movements. For the lymph, of course, you all know. Some say yes, your tongue is forward because you have lymph tonsil problems, so you should cut the tonsils away. Never cut tonsils away anymore. You can use the homeopathics. You can use Senum remedies. You can use so many things. You can do ozone therapy. You can do lymphatic drainage after Boda or whatever you want. You can use Ayurvedics. You can use color puncture. I'll tell about color puncture in a minute. Ozone therapy, of course, you know. And an important thing to know is whenever the lymph is swollen, I have a teacher who I like very much. His name is Peter Mendel, and he says the lymph is the border between conscious and unconscious. How many children get sick at Saturday afternoon or before going to school? They get fever and they get lymphatic problems. It's a way to not to get in contact with your feelings when you cannot get in contact with your feelings. It's a way to get your parents home because you want their love, not them to go away. It's a way not to go to school. You don't want to get a bad note. So this is so far for the lymph. We never cut these lymphatic things anymore. You know, they grow back. They give bigger problems than they were before. It's useless to do that. For the teeth, we use Bayonet and Crozat. We also use fixed appliances once in a while. When at the end of the treatment, the children want their teeth more straight, then we explain them. Then we use some acid, and the surface gets a little bit damaged, and the head might have problems. So on parallel, we do always craniosacral therapy if they accept it. Some people don't want it, and they just say, "Get my teeth straight and shut up with that stuff." And again, yes, that's what they do. And again, we work on the back. On parallel, we work on the back. No? It's difficult to say that I get your teeth straight without getting the back straight. They all go together. Back and teeth go together. So, especially in adults, they might be crooked but compensated. So if I'm going to straighten their teeth, they might get problems. And of course, all the things you do about amalgams and about Nico are very important, and we try to do them too. Okay. Now, advantages of Bayoneto, I will very quickly talk about them. They correct in one time the vertical, the sagittal, the transversal, and the midline. They leave a very big space for the tongue, and they're very easy to carry, and they don't disturb the craniosacral rhythm. So any other appliance that does these things is okay for me, but it's hard to find another one. The Crozat is a little wire thing you've seen. It's very easy to carry. It's even smaller. We use very, very light movements. Another advantage of the Bayonet, it's rhythmic. Every time you swallow, you do these movements, which is more physiological. And the Crozat disturbs very little with the craniosacral movement. We did measurements with little strain gauges. The cranium does move. You can see it electronically. There are very different rhythms, so you have to study on an FFT what is doing what, but it has nothing to do with the breathing, nothing to do with the heart. There is an extra rhythm, which probably is due to the brain tissue that does this. Good. So, we work a little bit with Killian picture, which I guess you know. It's simply putting your hands on a piece of paper, zap, zap, and you see what happens. I used to have one 10 years ago and a decoder, but the decoder I felt more comfortable, so I didn't use the Killian machine. But then I started taking it again. It's unbelievable the information that it gives. You can see these fingers, how they are closed. They should be about like this area down here. You can see how they're closed, how they're toxic. I don't want to get into that. It gets very far. But we do work with that whenever we can. And here comes a very important part. I don't know if you know the work of St. John, but he says that if you do reflex therapy on the feet, you know that on the toe side you have the back spine. You have not only the back spine, but if here is the myth of Achilles, where Achilles was taken by his mother and put in the water, which was holding him there. Though this is a point of life and death, we say. This is the point where we got to this life, and when you go to India, it might happen. They told me, I've never seen it, but I might have done it, that one person dies, they go over, they take their heels, and they stay there with their heels in their hands. And when the person dies, there's a big communion with this person who dies. It's an unbelievable feeling to have somebody in your hands like this when he dies. Good. So if this is where we were born, over here the first phalanx, and here all the weeks of pregnancy, and here's where you come to this world, it's easy with a little round point about 3 millimeters in diameter to touch all these points. And if you touch them, you will feel that some points will hurt. They will hurt. And if they will hurt, what this Mandel says is that you got problems with your incarnation in this life. And he says, here's the soul, here's the spirit, and here's the body on the other side. So these three things are not well coordinated. And so what you should do, you should treat this one with violet. Let's say the 4th week has problems. Okay, and again the spine. The back spine is, here's the coccyx, and here's the cervical part. So you can imagine the head over there on the big toe, and here is this part here. So it's very likely that while you have a problem here, and you're solving it, you might hear, and it happened to me just once, that your back spine goes click, and you have an autonomous correcting of the vertebra back on the patient. What you do here, in this part gives you a strong pain. You start crying very much. You go, really, like something fell on your head. Then you go here. Let's say you have a problem on the 4th week. You treat it, and while you're here, usually, not always, it depends on what you're used to. How are you? Oh, good, thank you. I'm fine, yes. If you're used to this, then it might not work. But if you're used to be open and be sensitive, then it might work. And the more sensitive you become, the more you feel it. So over here, the pain is very deep. You go, like you can't hold it anymore. After 1 minute, you go here, and here it's a soothing pain. It's a soothing pain like when you hurt yourself and you go to your mama, and your mama holds you and goes, yes, okay, and you go, like you're home again. And on the other side is the body, and the body is more, this is it, like getting a massage at the end of the day. You fought all day, and that's it. What Mandel says, I helped you incarnate in this body in a more coordinated way. Okay, and that's what we try, that's what we try to do. If we have the teeth that are crooked and the back spine that is crooked, of course, accordingly, then very likely we can have a problem in this part too. I remember this one girl. His name was Chandra, and she was like this, you know, and 12 years old with her mother, and we did 3 times this treatment on her. And the 3rd time, she dreamt her coming to this world. He described to her mother the room, the surgeons, and the umbilical cord around her neck. And the mother said, how do you know? I mean, you got born, how do you know? And while we were doing the treatment, the foot that was like this went like this. Like, you know, a muscle you take out when you eat it. I don't like muscles, but they go, yeah. The foot that was like this all the time went like this. And when she came down from the treatment bed, she was different. She wasn't attached like, she didn't attach herself like that to the mother. She was more free. She's not very completely normal now, but there was a big difference that happened when she lived again that feeling there. Good. And how to learn this? There are books in Germany which you might want to take here of Peter Mendel, color puncture he calls, not with needles but with colors, with lights. You can work on the skin. We have patients that recognize on the back, this is red, this is blue, so they can recognize the colors. And this is called prenatal therapy.
I have a phone number for the American teachers that teach the color puncture from Peter Mendel.
Great.
There's a couple in North Carolina that set up the school here in America. So you can ask them for the phone number.
Great, great. A very important thing is not to tell people how they feel, which is like psychoanalysis. Oh yes, you feel like this because this and this happened. This is not the point. Making you more stable. Now I know that when I'm depressed, it's because my father told me not to do this, and now I'm repressed, and now I know. This is not the point. The point is to get you in contact with your feelings, so that you're more, so you're less programmed. Actually, you're more free and less programmed. What we do with head strokes, we work on the head. We work on the head, and we call it hammer points. Hammer because of this genius, his hammer man of the cancer I told you before, which said you suffer with parts of your body. If you suffer with your liver, he have seen he worked with dogs and with elk, and the dog got very mad. It was a big dog, and he got a little, how do you call it, basset hound, no, little ones, and he was eating his food away, and he developed liver cancer. They took the little boy away, and the liver cancer went away, and this happens all the time. I remember one girl, she was a journalist, very aggressive, and she had a teratogenous cyst on her ovary and wanted to be operated the next week. And I sat with her, and she was very aggressive. It was very hard for me too. And suddenly I was, teasing her how I do. And suddenly she said, I said, how's your partner? Oh, good, he's gone. Huh? And did something happen? Oh, nothing. Huh? What, nothing? What happened? Yeah, he went with another lady, and I was with him, and he got a child with another lady suddenly. And he just told me I have another child, and goodbye. That bastard said, wow, what's going on? Yeah, I thought I might develop a monster to show it to him. And then she goes, 1 tear. Boom. Okay. Good. I was, it took me 1 hour to do this. Thank you. How much is it? Nothing. Goodbye. Took me 2 hours to recover. And after 2 weeks, she didn't call. She had the friend that sent it to me call and said that cyst had exploded. Pop, was aware, wasn't there anymore. And that happens all the time. But we must help the people to get in contact with these things. And the way to do this is not to change the world, but to change ourselves. If we get more sensitive and sensible, we can feel so many things, and we can help the other people feel. Because many people don't want to be healed. And I guess you agree with that. They come to us, they make us become crazy, and we put energy into that, and if we succeed, we say, oh, good. And if we don't, we get depressed. And we shouldn't. Huh? So that's why, we should get in contact more with these things. And this is the father principle. The father principle, this is what made me get in contact with color puncture. I didn't really believe too much in it. And this Peter Mendel told me, okay, come over. It was many people, like here, and he treated me here. It's 3 colors, here, here, here. We don't use lasers. We just use normal colors. These people might have them and sell them. Laser, if you look into a laser, it's quite aggressive. It's not so good to look into it. But it works very efficiently and very fast. We use very soft colors. So this is the father principle. You work with it over here. When they did it to me, I stood up, and then I was like this, and then I had to lay down, and I cried half an hour long, and I couldn't get close to a man anymore. It was very hard. I would see you there, I would go, because the male energy who had hurt me when I was small I was getting in contact with that. But I was putting we say our balls in Italy, it's not very polite. We put our responsibility in the hand of our men of the time. May it be politicians or whatever, managers. We don't take our responsibility. And so that's why we look for strong people. I like that. I like he's a strong man. I like what he is able to do I wasn't able to do, to be a strong man. But usually I like what's not integrated. What lacks in me is too much in him. And so he gets me problems after a while. You know? We also work with couples. It's very interesting how these things work in couple, and how if one grows and is not dependent so much anymore, the other one either has to grow or the couple splits. You know, they're both dependent. I'm too much because you're too little, but I'm too sweet because you're too sour, and so when you get equilibrated, then the other one has to equilibrate too. These are things we try to do with our patients. Imagine how difficult it is. Sometimes they don't want to, you know. So we try to explain it at least. So this is the father principle you can work on. Any patient that is like this, class 3, you know, you can try simply to work with this and see what happens and talk with him. What he thinks about authority and about power and about these things. So, and here simply I want to show you how it's, again, this is the very embarrassing part. It's not beautiful at all. But just how palate, this is a class 3 patient. We broke the slide that shows from the front. And the palate can get much bigger anytime. And if it's narrow in class 2, it can get bigger anytime. We can have huge changes. I've been working 12 years long as an orthodontist, and I've sent one person to be operated. And this patient had big problems here. The other ones we didn't. We extract about 4 teeth a year. And we use 10% fixed appliances for people who want more. Don't wear appliances. This is not the ending, because this occlusion is not good at all here. It just wants to show you that this is grown up. He has his second molar here, but you can solve midline problems. You can solve second-class problems. Again, equilibrating, putting the mandibular in a way where it's in class 1, helping you to swallow correctly, helping the back to be equilibrated because it was crooked, otherwise this wasn't crooked, and helping somehow with emotions. This one is colored, as you see. This was the last funny thing we did. Since, for example, wisdom teeth. Okay, it all happened 4 years ago. They called me from Baden-Baden. They say, hey, you're invited to the Congress. It was very exciting, and I was very embarrassed because I learned so many things there. I didn't know I could tell them anything. So I took what I showed them. I took about 20 patients where nothing worked. Not too well at least. And we did to them color therapy, color puncture, mother principle, father principle, prenatal, and they all developed very quickly and very well. So we saw that emotions give contractions, and contractions don't let, usually it's crowding problems. We have very bad diastemas we cannot solve. I cannot solve. For me, it's a very good sign if you have very big, you call it diastemas? Huh? I mean, it's beautiful. These black people with this beautiful, usually they're free, they're happy, they're out-mouthed, how we say. A friend of mine got a patient from Poland, and she had a diastema, and her father said, please fix the teeth, but not that. Why? Because in Poland we say, if this is open, you're sexually very good. So please don't close that. My daughter has to get married. It just shows you that the energy is big and good. So why straighten it? I didn't understand why to straighten teeth at all. Why is my father straightening the teeth? Who cares? You're not equilibrated, and I'm putting my fingers violently in your body, not knowing what I'm doing. I don't like it. Now, I like it better because I know that I can equilibrate many things. And we were invited last year in a convention about back pain, and we brought these things. And the most applauded man was a guy from Denmark, Norway or Denmark, again a Scandinavian. They are very scientific. And he had 3,000 works. And after 1 year, they took many of them away, only 30 remained. These are scientific. These have all the parameters that make them scientific. And after another 6 months, only 5 works remained. These are completely scientific. They have all the parameters. And what they decided, that's a cause of back pain. The only thing that was really relevant was the troubles you have with your company in work. If you fight with a guy that's close to you in work, that's relevant. So it was the only thing. And they find out that 1/3 of the people that get operated for lumbar problem get worse, 1/3 gets better, and 1/3 like before. So that means that we're completely in the placebo also with the very scientific operations. And that means that actually psychological stress and tension can give you muscular tensions and can give you back problems. And so we're all back to treating the psyche if we can, because it's beautiful. So, here again, can you andare avanti? Okay, this is a guy we couldn't treat. This I told you, the diastemas we had a hard time treating.
Sexy, though.
Very sexy, yes, very sexy. So malocclusions are bad positions of teeth and are the consequence of a not optimal neuromotorial coordination, which has as a consequence a not coordinated muscular function. This muscular function gives us malocclusion as a result, not as a cause. Using anamnesis, using also psychodontia. If you go to Brazil, there's a beautiful place by Paulo Nogueira de Sá, is in São Paulo, and he is the chief of the department, which you might like to get in contact with, of biocybernetica buccal, buccal biocybernetic. And he describes, for example, if I have teeth in my hand, I can decide how your psyche is. And he's very much into that. He said, for example, if a long canine and you have premature ejaculation, you just grind it and it goes away. Then he found some interesting thing about crossbite and homosexuality. And then a very nice slide, which I don't have, of course, shows that a lot of pathologies just changing the shape of the mouth. Now, good. Nico, good. Electricity, good. Meridians, good. But changing the shape of the mouth, how can you get rid of back pain? Okay, but dyspnea, how can you get rid of diabetes? That's strange. Changing the shape of the mouth, I don't know how to explain it. The energy flows differently, or whatever it is. You feel differently. Imagine how you feel if you... Now, try to swallow with your tongue on the palate. Here. Okay? Somebody will be able to do it, somebody not. Try to put your tongue down. Swallow with your tongue down. Difficult, huh? Do it 10 times. It gives you a feeling, a particular feeling. Anyways, the shape of your mouth gives you a particular feeling. And if I change the shape, your inner world changes too. So, here again, this was just a patient. You see here in a very night slide, the canine, it couldn't come out. And this was after 4 months of treatment. It suddenly developed. It was one of these patients where we had to do something for the Congress. So that was it. It didn't come out. I've been working for 4 years. It didn't come out. And these are the pictures we should take them, except a couple of big mistakes, like up here. This shouldn't be seen, but you should. You take these kind of pictures? No? Oh, it's very, very important. This is the face, and this is from the right, this is from the left. Now, you can make a horizontal here, and you can get this together and see how on this case, for example, I can be class 2. On this other side, you can be class 3. This is a very nice way to get in one picture, three-dimensionally, what's going on. It's no use to make an X-ray here and an X-ray here and then analyze. This is much more useful. Okay, this is just a patient before and after, but you can't see very much. What you can see is just little changes. The lower face that's higher. She was in chronic pain and all the stories which we know from every congress we go to. And I just, a very bad picture again. This is Browner. This is impression here. You can just see the midline swifted. It was about 10 months of treatments. Here you can see the midline that's higher. Okay, one thing. It's very hard to get the bite higher right away with composite or with bridges if the swallow doesn't follow this thing. Like, I can do it higher in 2 seconds, and he says yes, but if I do it violently right away, I might get big problems. I must do it slowly. I must do it with my experiences with things like this, which you can take out also if you want. All in a saddle, you will see that the patient won't be able to go back anymore. It will be hard to go back. He likes to be in front. And if I close him, I'm going to hurt him. So I'm going to have a new dimension because I gave him a new position because he could swallow well. And also, he was invited to swallow well because of these things here. And also have these colors, which is a little game we made. We worked with colors. If you have a dysodontiasis of the last wisdom tooth, take violet and put it back there. We had 60% of our patients who came in with acute pain. You said homeopathic don't work for acute things. That's right. Colors usually not, but that when acute pain, you just take violet light, put it on the last molar, and we had a big part of patients, as I told you, that went away without pain the first time. We had them come back, and after about 5 sessions, 80% didn't need any other treatment. So from this idea, and you will see the slide now, we thought, why not make a optic fiber like this and get all the light in all the parts of your teeth? And since we do this, people like it better. It's rainbow, bionator, and it works faster. We don't know why. So it's almost finished. Okay, and this again, it tended to be in class 2, and the pain of course is away, but you can't see that the pain is away. And here I'm going backwards. You know, and this is how the bite gets higher. We use it also for parodontosis. For parodontosis, that's not your argument, but we can use color puncture too. Always when the gums are bad, the intestine is bad, we have to equilibrate the whole thing, of course. Forward. Okay, another patient, and this was 9 months of treatment. Puoi andare avanti questo qua per piacere? This takes some time. This was before, this was after. You can see how the head is forward like this, how she's lymphatic, swollen here, and this is what happened in less than 1 year. Puoi andare avanti qua per piacere? This 1 year. This was a difference. Excuse me for the pictures. Okay, and she was in my color treatment, in my color courses. I give courses for color treatment, and they're very experiential. Like somebody asks me, and I feel the energy is strange. You say, "Great, come here. We work with you." And so she was very open. And while she was wearing this, so many things happened. She went away from where she was working. She got independent. Now she didn't have any money, and you know. But what we see all the time is that when the psyche changes, and usually people when they get in class 1 get more free. We just have to look at it. And we have to help them getting more free. If we extract teeth, if we do surgery, we help them to be castrated. And we want free people, because if they're more free, we're more free. We don't want them to be dependent from us. We want to be free and happy with them. Okay, this is Dr. Baltas. This is the apparatus we make. We'll try to make it in silver. It was this beautiful conference 2 days ago. And Baltas, you see the reflexes you can have just touching different areas. These are original designs of Baltas. Another thing he said, do I still have time?
Yes.
Real
quick,
yeah.
why don't you get ready to end it?
Yeah, 5 minutes?
Yeah.
5 minutes, okay. Okay, what Baltas said is that crooked teeth are due to lymph problems. And my father used to tell me 10 years ago, listen, this guy says crooked teeth are lymph problems. And I was laughing too, oh, how funny. But it's not. And he says it's like an egg. If you have the egg with the point backwards, you have a lymphatic blockage here, which you can see from an imprint. You have little cloudy appearances on the cast. And what you try to do is to reverse this. You can have it in the frontal, you can have it in the sagittal, and you can have it in the lateral. Okay, so actually what this device does, it also regulates the lymph deflux. And the hard thing to understand is in class 3, we go even more forward. We go a little bit more forward. We go towards the lesion, the craniosacral lesion. Another thing, this is a thing you know, the problem is on the lip, which we can have, it's intestine. So anytime you have herpes, work on the intestine, the herpes goes away. I think the herpes is a way to help the intestine to get well. And here you have this are from Maya, which really you know, which says the back spine and the palate are in direct correlation. If you go further down, you can see the stomach, how the stomach changes. If you intestinal problems, how they, and we have lots of children. If you go to the sea in Italy, lots of children, 5, 6 years old, full of cellulitis, eat pasta and spaghetti. But also here, we've seen this year, obesity is gaining much. Strange. I thought you. Anyways, intestinal problems give you muscular problems in this area, which give you muscular problems in this area, which give you malocclusion. So another way to work is to work on the digestion. So these are the Krozat. This is my town, and this is how we develop the Krozat, smaller and smaller all the time. These are simply Otto 8 studied different classes, which I like much better than the classical one we use. And these classes are functional classes. They just talk about how the tongue works. They're not bony classes. And these are, it's not so interesting, these are all the apparatuses from complicated to simple, which Baltas developed until he got to this very, very simple device, which has no screws, no nothing that's not necessary. And this wire, the philosophy about the wire, which should barely, not touch the teeth, but barely with 1 or ½ millimeter every time the patient comes to you. Sometimes the only thing you do, also to learn this, you do much less work. You don't have, this is broken and the the wire is away and you have to regulate and make it bigger. You leave it in the mouth. You can have patients be away 8 months and it works. All you do is, well, you grind away the plastic where the tooth has to go, as I told you before, because the depression is created by swallowing. So it doesn't push, it pulls. And this one, every time the patient comes, you try to change a little bit. So he gets a new proprioceptive influence to how to do this. So the secret is teeth apart, lips together. Okay. And here again, this is a very difficult case that Paolo Tonini is back there. Paolo is my technician. He has been turning around the world with me to learn these techniques, because this guy Balta died. Like you said before, this guy in Switzerland died, and we didn't know where to learn it, because this is air, this is clouds, it's not forces, it's what is it? So we went to these old guys and talked, and Paolo was with me, and so we learned these techniques together. And it's almost finished. This is class 3. Simply puoi andare avanti con quello lì. Stop, non andare avanti. Just the opposite, puoi andare indietro. Just the opposite is a lip bumper. What is a lip bumper? Lip bumper is something, Setlin talk very much about lip bumper. And he says you take this away and the lip push against it, and so the teeth back here pushed back by the lip. We say the opposite. We say lip bumpers work good, but here I want to stimulate this lip to do this. Okay? So that's what, in class 3, I put it down there, which doesn't sound very logical. And these are simply other things. This is the volume of the mouth, how it changes. And, okay, this is the volume of the mouth in class 2 with the construction about how it changes. See what big difference it is? And all this difference is going to be filled up. My feeling, again, it's not scientific. Well, scientific perhaps with that Lucia test, we demonstrated it, but that the whole wealth of the patient and the psyche of the patient is much better off if the space the tongue lives in is bigger like this. This is a compressed area. Okay, and these are just the waxes we used, and this is incastrato quello lì. And this is how you can control the occlusal plane. Which other device to control the occlusal plane? What can you use? You can use a palatal bar, which you can give selected torque to expand one or another, but either you correct the crossbite or the occlusal plane. In here you can correct both, simply grinding wherever you want and letting the tooth come out. Letting the tooth come out. Can I show you something again? You again? Can you I hope he plays this time. Wait. So that's the way how I explain homeopathy. I show you. I don't know if it works though. And how this works too. Okay. Now, just watch, huh? See how it works? This is homeopathy. And this is the way we try to work too. Just letting the tooth come out if he wants to. He still pulsates. He wants to erupt, and so let's leave him the room to do that. We don't have to pull him there. To pull him there, we have to push somebody else in a different place. And having this with a delayer mask or this, they might not be so happy. We should ask them what they think about it. Okay, and here again, simply grinding in different areas. We have the teeth moving, but Paolo, ancora quello lì. And these are again just bites we take, but we also take for back pain. And this is just symmetry. We just look for symmetry. We don't do any more kinesiology. We don't do Jenkinson. We just look for symmetry and equilibrating while we found the symmetry. And again, putting something in the palate for us is very strange. We don't do it anymore. And we try to, this of course can be big, and actually it could be smaller just looking at it. It's a very small palate. Paolo always looks for the most difficult cases to put in the conference. Is very embarrassing. And this also, of course, how many you have like this? Also, if a guy swallows, we don't say no, we enhance him to do it more, and then we look what happens, and well, it's another argument. And okay, this is a very difficult case. And this is class 3 again. And this is Venice again, where we did a congress of natural dentistry about 5 years ago. It was beautiful. This is in front of San Marco. And this is class 3, and we use also these little things like Frankels, but we don't touch the mucosa. The guys have to have them in the mouth all the time. And if we use things like this, it's not to push the teeth, but to push them where the space has been created, which means the guy moving front or back the mandibular can or not stimulate these things. You see it's away. But if this space is going to create, it's going to come out. I'm not going to push it away like in many appliances. I'm going to leave it there. So moving it around is going to push here and there and create a depression, is going to create space. But instead of adding plastic, which is tiring, sometimes I do this and I get it very close without pushing. You shouldn't feel it when he closes his mouth. And here again, a color puncture following mantle. This is from red to violet and ultraviolet, all you can have. And this is the way we convey the light in the mouth, and we think the muscles are very much more relaxed. It's a classical crosshat, quite thick, and that's the way we did it at the beginning. We used to plate them in gold, and that's the way simply we do it. Now, if you're not used to this technique, they all look the same. For us, they're very different. I don't know if you can see here the big arm. It's a very low deflection rate, which is important every time we move the tooth. And here again, the difference between before and after. The guy shouldn't even hardly feel it, and there's a much place over there. Sometimes we're obliged, if the teeth are not too conical, we use these kind of plates, but never plates where the whole palate is closed. And using these quadelics for us is like seeing a cow fly. We don't do that anymore. And puoi avanti ancora, Paolo. So, and this is the castle, and just makes a stream. Yes, and that's it. Thank you. Paolo, venite tu.
Because of time, I want to see how many people have to catch planes and get out of here. So not a big hurry? So why don't we have, why don't you ask your questions for the doctor now, and then we'll have our panel discussion right after this. Is that okay? Yeah. All right, so pardon me? No, there's no hurry on that, I don't think.
No. Tell them about the celebration at the end.
What we want to do is when this is over, we're going to have a little a prayer to end the services, and some and Don Bartram is going to do a little prayer celebration and gift to Dr. Arana, so don't all run away. So field your questions now for the doctor, then we'll take a 5-minute break, then we'll have our panel discussion. How's that? 5 minutes, that's it.
gets you lymph problems. Breathing through the nose gets rid of these problems and helps you to follow better. So what we do, again, we do that run, all those gymnastics, which work very much with swallowing, but not only swallowing, also with walking, looking, and all these things, you know, like if you vomit when you turn around and go in the car, you made it. So I'm going to work with this. That's how to yeah. Get better, much better. Depends. Yeah, when we can, we make holes there, but sometimes it doesn't hold, it falls down. So I'm not very clear in this direction, but when I can, I leave the palate open to stimulate it with the tongue. We tried, sometimes it doesn't hold, sometimes it does hold. Yeah. No, it's very easy on adults. It's very easy. Difficult on adults. See, there's always something behind the question. I don't know what you're asking exactly.
Because you said on children you rehabilitate children.
No. What I said, children is easy. Whatever you put in the mouth, they equilibrate. You can also create problems. They equilibrate. In an adult, if you make a mistake, he's going to come with his back blocked. So I say, doing orthodontics, the ones of you that do orthodontics with adults, we have them sign big sheets like this, that if I do create a problem, it's your responsibility and so on, and you're aware that you might get problems. I don't know. You work with adults with orthodontics? Yeah. Creates huge problems. Yeah. Huh? And since we do this, we usually solve big problems. We have patients coming for backache, and we say, excuse me, but we have to straighten your teeth. And sometimes they don't understand. But we try. We simply put the wax in put the wax in the mouth, edge to edge, make them move their hands back like this, make them walk, and sometimes they say, hey, it's unbelievable. Now what next? You have to wear something. It's better to wear it all day long. But if you have a big pain, you will decide when you wear it. And if you swallow rightly, while you wear it, there the whole process, it's a good investment because you start swallowing as if you should swallow if you would be in class 1-1. So this is the magic, I think. Yeah? No. What does he do? Good, thank you. Yeah.
Question: you use silver for the labial bone. What gauge? Because silver is quite soft.
Yeah, no. I thought we were thinking about se usi argento per i fili, che fili usi.
What gauge silver? Because silver is quite soft.
Yeah, no. The idea was to use silver to change the bacteria in the mouth and the environmental space.
Don't use silver.
No, we're trying to. It's too soft. I know. We used to golden plate it, so we might silver plate it. We might see what happens. Yo, the soldering, dillo. The solderings are silver in the crozets. That's all. Yeah. Okay. Yes? Excuse me? Yeah, of course. Yeah, I don't know what case you're talking about, but there are some horrible cases, terrible. These no, but yes, there's always if we are smart enough, we can find a cause why this maxilla is smaller than that one.
So basically, your assumption is that the cause or the etiology of the malocclusion is
Yeah.
from an imbalance, right?
Yeah, there's nothing inheritary about the bone structure. I think everybody.
Except for in the mandible. I mean, isn't there
No. Mandible too. It's rubbish. I don't believe in it.
Even when they do the in vitro studies where they can actually grow a mandible and
I don't really. You know, there was before the Second World War, there were big books written why the airplanes couldn't go over the sound limit. You know, big books. And all of a sudden, Hitler developed the first V1, and you heard bang, and all these books went in the tank. And so, if they tell you the mandibular is in hereditary, this and that, I don't believe it, because we have children where you do not use appliances. We change their function, we change their way they swallow, and the mandibular doesn't grow anymore. Of course, the mandibular grows and grows more than the maxilla, and it's normal to be class 2 when you're small. I understand. you know. But when does I remember a work of a Japanese guy from 5 years to I think 17 years. They used the layer masks, and when it was finished, it was perfect, class 1, and they had exactly the same results and the guys that did not treat. You know, so this was just violence, and the function didn't change. And if it would be inheritary, then okay, what can you say? Tough luck. So I still have to change the function and these things. So I don't believe in.
I disagree. I'm just curious what your idea is.
Yeah, nothing is hereditary. Just the function is inheritary, and the pathological attitude, which gives you a morphology, which shows to your neighbor how your heart is. This is hereditary or influenceable.
So when you treat these early children in the phase 1 treatment, then you usually find that they treat after class 1s long term.
Yes.
They come in class 2 and you get them all class
Yes.
1s with the adult.
Yes. Simply using this device, if we cannot get, we have simple people that come from the mountains. We cannot talk to them about feelings and so on. So we say, relax, it's okay. We just put this appliance. Sometimes, if they do the gymnastics, they're more coordinated, they're happier, it's unbelievable. But if you don't even want to do that, you use this kind of appliance, which leaves the mouth free and so on and so on. So it doesn't work better.
Great stuff. I'd like to have all our lecturers please work their way up to the podium in the next couple minutes. I'll put some chairs up here. If you want to take a